Hi, my name is Merrill Stewart. Thank you for listening to my speech today. What is something that affects over 44 million people in the U.S. every year? Anxiety disorders. My speech is all about anxiety. As a person diagnosed with anxiety, I have researched the topic extensively, through not only websites, but through books and expert counselors as well. It is highly unlikely to go throughout a day without hearing about the impact of anxiety on one's daily life. Today, I'm going to share with you the information I have researched about anxiety. To understand the behavior of a person with anxiety, one must know exactly what anxiety is. The Anxiety and Depression Association of America states, an anxiety disorder refers to specific psychiatric disorders that involve extreme fear or worry. There are two types of anxiety: general anxiety disorders and social anxiety disorders. Anxiety is more than the typical worry, which is temporary. Anxiety increases throughout life. As a person diagnosed with anxiety when I was 9, I understand this very fully. Anxiety disorders linger, even when life seems like it's going just fine. According to WebMD, panic attacks can occur randomly and without warning, and the anxiety takes over a person once again. Elements Behavioral Health states that general worriers spend about 55 minutes a day worrying. However, people with an anxiety disorder can spend over 300 minutes a day worrying. Also, according to the Anxiety and Depression Association of America, anxiety is the most common and prevalent of mental disorders in the U.S. Psychology Today states that some causes may be due to genetics or one's environment. Anxiety also has many noticeable symptoms, which doctors utilize to diagnose people with anxiety. According to the National Institute of Mental Health, anxiety has a wide range of symptoms, including feeling on edge, fatigue, irritability, concentration problems, sleeping problems, muscle tension, and of course, worrying. Some even have suicidal thoughts. Symptoms can differ. Some can be more extreme. However, mine are just irritability, worrying, and sleep problems. Having anxiety can make you feel distant from others, which can strain your relationships with your loved ones and can cause feeling of worthlessness and emotional scarring. People with anxiety must learn to cope with their symptoms and to seek appropriate professional help. It's tricky, however, because social stigma can cause one to not want to receive treatment. According to Psychology Today, most anxiety treatments include exposing the patient to face situations that may trigger panic attacks. Some medications used to treat anxiety include Xanax, Zoloft, Lexapro, and Prozac. Finding the right medicine for you can depend on your treatment and how well the treatment works. Getting professional help from a counselor is also a very wise thing to do, and I can explain that personally. Anxiety and Depression Association of America states that even though over 44 million Americans have anxiety, only 1/3 of them receive treatment. 1 in 4 people will experience anxiety at some point in their lives. Being able to discern the severity of the anxiety is essential. Recognizing symptoms can lead to a successful treatment and diagnosis. I told you what anxiety is, the symptoms, and treatment. My purpose was to inform you about anxiety, the symptoms, and treatment. I hope the information provided to you helped you to understand the daily struggles of someone with anxiety. Thank you for coming to listen to my speech.